Hello everybody, this is Binu and Dr. Bijoy. We would like to have a coffee conversation with you today. This is basically of something that is of interest to everybody, and I would like to invite Bijoy to introduce yourself.
Thank you, Binu. My name is Bijoy Maliel. Official name is Kurian Maliel. I am a cardiologist. I practice in Ohio. I'm happy to be part of this project that he is doing.
Bijoy, we would like to ask you some of those questions connected with the cardiology and heart attack today. How about that?
I would be happy to answer any questions you have.
Awesome.
I'm excited and looking forward to it.
So I think I have some questions that I would like to ask you. These are basically the questions from a common man's perspective, and we just use this one for educative purpose, not for any medical prescription or anything. It's not a treatment plan or anything like that, just for educative purpose, for teaching. And please ask if you have some questions. Please ask on the continuing conversation. We would like to enjoy. We would like to bring some of those conversations with you. Bijoy, can you explain more about the heart?
I'd be glad to do that. Let's talk about the heart. I have a model of a heart right in front of me, and I'm going to show you basically what the heart looks like, what are the chambers of the heart. First off, the basic and the most important function of the heart is that of a pump. Okay, so here we have a model of the heart. So I am going to open this up to show you the inside of the heart, okay? Okay. So here, the top two chambers are called the atria, and the bottom chambers are called the ventricle. So here is the right atrium, which pumps blood into the right ventricle, and here is the left atrium and the left ventricle. So between the right atrium and the right ventricle, we have the tricuspid valve. Between the left atrium and the left ventricle, we have the mitral valve. So the right ventricle pumps blood to the pulmonary system, the lungs, and the blood returns from the lungs after it is fully oxygenated into the left atrium. The left atrium, from there the blood travels to the left ventricle, and the left ventricle pumps the blood out through the aorta, this big vessel, to the rest of the body. So heart, this is the function of the heart, is to pump blood to the rest of the body and function as a pump. That is its major function.
Can you explain to us about what is heart attack? Heart attack is actually a very alarming issue in the medical field, as well as physical health is concerned. Can you just explain to us what is heart attack?
Okay, so let's talk about what happens during a heart attack. So this is going to be a basic review of what is happening during a heart attack. As I've shown you before, I have a model of the heart right in front of me. Now, I told you earlier that the heart functions as a pump. Therefore, heart is a muscle. And every muscle needs blood supply for appropriate function. Now, you see here that there are these arteries that are painted in red, here, and there are veins that are painted in blue. Now, heart itself needs blood supply for it to work. A heart attack is a process in which an acute blockage happens in any of these blood vessels that supply blood to the heart itself. Therefore, heart as a pump is impaired due to lack of blood supply to the heart itself. Now, this can be caused by an acute block from an acute blood clot, or it can be caused by other reasons. But basic understanding is that an acute block, that means a sudden stoppage of blood flow to the muscle of the heart itself, will impair its function. And it is usually followed by pain for the patient. So that's a basic, a basic definition of what a heart attack is.
So now you said about a heart attack is actually a blood clot that happens in the arteries. Actually, how do that happen? The heart is actually pumps blood out, and heart also needs blood in. I mean, blood to survive or to function its own. So how do that get blocked? You said about that it get blood clot. and how do that happens?
Okay, I mentioned earlier that heart attack is caused by an acute blockage, usually due to a blood clot in the arteries that feed blood to the heart itself. The way it happens is that, remember, the blood clot is not forming inside the chambers of the heart. We are talking about blood clot that forms in the arteries that feed the heart itself. Now, this is due to a process that in cardiology we refer to as plaque rupture. Almost all the people that are usually older in older age group have plaque buildup inside their arteries. Okay, plaque buildup meaning that plaque buildup due to cholesterol plaque. Okay, so under stress, these cholesterol rich plaques can burst open, and when they burst open, blood cells will come into contact with epithelial cells, and they immediately starts to form a clot, and that's how the arteries gets acutely blocked, and that abruptly stops blood flow, leading to a heart attack. Now, there are different forms of heart attacks. There are mild, small heart attacks to heart attacks that are very severe that we refer to as STEMIs. I will not get into the details of all of that, but for the general population that we need to understand is that this is due to cholesterol plaques that build up inside the heart that are unstable, and they rupture open, leading to an acute formation of blood clot that abruptly stops blood flow through the arteries which feed the heart as a muscle, and the function of the heart becomes impaired due to these blockages.
Vijay, I've heard some people saying this, during heart attack, heart burst out. Is there any truth to that? Is there any reality to that? And as you are saying or telling me, I mean, it won't match with what you're talking about. Give me your opinions. What do you think about it?
Okay, yeah, I've heard people ask me that question, that they think that when during a heart attack, the heart is actually ripping open. That's not accurate. However, let me explain. So, as I mentioned before, this is due to an abrupt stoppage of blood flow. So, let's say I'm pointing to the heart here. Let's say that this artery is blocked and all of this muscle here is not getting blood flow. And when that muscle doesn't get flow of blood, it doesn't work very well. And that muscle tissue there can actually infarct, or in other words, that muscle tissue can die and become a scar. So, in a person who've had a heart attack, it is possible that after a few days, if a large portion of muscle tissue has died, that portion of muscle can rip open and cause bleeding, and that is absolutely catastrophic if that happens. That is considered a very emergent situation. So generally, to answer the question, in general, that's not the case. However, after the heart attack, it can happen in the next few days for the heart muscle to rip open.
Another thing that I want to ask you is, some people have, you're talking about the valves, and, some people have replaced their valves. And what is that all about? Like some of those treatment options, what do you think about that? Can you just please tell us more about that?
Yeah, let's talk about the valves. Now, this is entirely a different topic. This has nothing to do with the heart attack, but just for sake of understanding, let's talk about the valves. Now, I mentioned that I showed you earlier the chambers of the heart, and between the chambers there are valves. Now, the function of the valve is to open to let blood flow from one chamber to the other, and then close so that blood doesn't regurgitate back into the other chamber. So it keeps the blood flowing in a sequence from one chamber to the next, to the pulmonary artery, from the pulmonary artery down to the left atrium, from the left atrium to the left ventricle, from the left ventricle to the aorta. Now, some people have problems with their valves. Their valve may not function very well. Some of the valves are tight, meaning that it is stenosed, it doesn't let blood go through. Sometimes the valves are leaky, meaning that when it closes, it still lets blood regurgitate back into the other side. Usually, valve problems are treated with, valves are mechanical structures, they open and close. Medicines don't usually treat valve problems very well, and they have to be treated with either surgical or interventional procedures to open up these valves or to help them close better. That is not, that is done by valve surgery, and it has nothing to do with having a heart attack.
Okay. So there's a replacement of those valves takes place during the surgery.
Right. So the valve can be either replaced
Okay.
or repaired by a surgeon, cardiac surgeon, or the valves can be opened up using interventional techniques without opening the heart, without opening the chest. That can be done interventionally.
As you're talking about recently about some of those treatment options, what are some of the latest treatment options available, especially for the clients in the United States? And I'm sure it may not be the case in India. They may be a little not advanced to some of these treatment options. Tell me some of the treatment options that you think.
So it kind of depends on the treatment options that we have available. So the treatment options for a heart attack is different than the treatment options for the heart valves. So let me talk about the heart valve. The treatment options include, like we talked about, surgical replacement. For example, if your aortic valve is stenosed, it can be removed and another valve can be placed. Now this can be a bioprosthetic valve made from animal tissue, or it can be a mechanical valve made out of metals. That's one way a surgeon can replace the valve, thereby solving the problem. Other treatment options nowadays include interventional procedures. When I say interventional procedures, what I mean is it is usually done by a cardiologist, an interventional cardiologist, who goes into the heart through the term keyhole procedure. They go in through a small opening into the artery, usually through the arteries in the leg. They go up into the heart, and using techniques they can open up said valve or even replace a valve, which is one of the newest things that's going on. It's called TAVR, which is aortic valve replacement through an interventional approach.
Awesome.
Those are cutting edge things that are going on in the United States, and I know that they have also been doing them in India.
Awesome. See, is there anything that we can do? There are some people are very have some hereditary reasons or some of those causes that actually they are more prone to have a heart attack. Genetic reasons or some of those. And what is some of those findings recently? What are some of those options available for people?
Right. So there is a strong genetic component in regards to having a heart attack. So a family history is very crucial and important thing that we as medical professionals look at to decide a patient's risk for having a heart attack. There are some genetic conditions that predispose you to having a heart attack earlier. Hypercholesterolemia, familial hypercholesterolemia, for example. But 90%, I'm just making that, majority of the patients have a heart attack due to the processes that which I discussed earlier, due to plaque rupture. And the genetic factors include having a strong family history of having a heart attack, high cholesterol, hypertension, things like that, obesity, things like that, diabetes that predispose you to having a heart attack. So there is a strong genetic component.
And let me ask you one more thing. Is there anything that we can do to prevent or outside of medical treatment, prescribing medicines, or what do you as a doctor tell to your patients that they need to take care of? The aspect of food, what they intake, and what kind of medicine that they need to take, and things like that. Sometimes people just simply take pills, and keep taking pills, and may not be good for them. Things like that. How do you what are some of your suggestions as a medical doctor to common people who have this issue of heart attack, or they have some genetic reasons and things like that? How do they take care of themselves? What are some of your suggestions?
So first off, we have to understand that preventive cardiology is a very broad topic, and that there is lots of research going on as we speak into finding out what all the things that we can do. But in general, I'm speaking in general terms. There's a lot of things that we can do to help ourselves. Number one, healthy diet, being active, exercising, taking care of your diabetes, and most of all, the important thing is to go see your primary care doctor, get your routine checkup done, such as your blood pressure, your hemoglobin A1C, for example, to check for diabetes, and get appropriate treatment and screening done early, so that you will have, that's the best way to prevent things like that. There is not a 100% preventative method to prevent a heart attack. But there's a lot of things that we can do, like I said, to include healthy lifestyle habits. We can talk about that at a later time. What does it mean to have a healthy lifestyle? What is the American Heart Association recommendations in regards to how much should we exercise? What is the American Heart Association recommendations in regards to our dietary changes? That's a broad topic in itself, and lots to talk about, and we can talk about that later as far as and go into detail as far as what are the recommendations.
And I'm sure our audience might have enjoyed this conversation. And if you have more questions, please type it underneath this video, so that we will keep coming back to you with more profound conversations in the future. And we wanted to thank you, and I'm sure Bijoy also wanted to say a few things to conclude this conversation.
Well, thank you for having me, and I've enjoyed talking with you about the heart. I'm always interested in talking more about the heart. This is my passion, and I love it.
Thank you very much.